All right, well, we have good news in the fight against cancer. A new analysis reveals that the death rates are actually declining for most common forms of the disease. Well, some experts believe that that's proof that the research is working, but unfortunately, black cancer patients are often left out of potentially life-saving clinical trials. BNC's Eric Cox explains how one national nonprofit is helping African Americans get the care they need.
Theresa Staten is grateful for every day she spends with her mother. In 2016, Staten was diagnosed with stage 3 cancer. Standard treatment wasn't working, so she started taking part in a clinical trial, driving over 80 miles 3 times a week, and travel costs were quickly adding up.
Yes, it was a struggle for us. Cancer is something that is difficult within itself. The stress of trying to deal with cancer, and then on top of that, the stress of like, how can I get there? Take your time.
But soon, Staten learned about a potential lifeline to relieve some of her financial strain, Lazarex Cancer Foundation. And not long after Staten reached out, the reimbursements started.
It was such a big help. It helped you pay for your mileage, for your gas, your parking.
Oftentimes, too often, in fact, it comes down to, do I save my life or bankrupt my family? We can do something different, so why don't we?
Dr. Maria Shagog is dedicated to eliminating health inequities. And with Lazarex, she works to help black cancer patients cover the costs that come with taking part in clinical trials.
It means that it could be the difference of extending somebody's life, indefinitely, or 3 to 4 or 5 years. And the fact that they are not given that opportunity, it seems kind of a tragedy.
Improving outcomes, reducing disparities. Last year alone, the nationwide nonprofit provided support for over 1,000 people to take part in clinical trials.
Wait, sit down.
And because she got to stay the course, today Theresa Staten is cancer-free.
And I know that without the company, that it would have been still a struggle. Sometimes we want to give up, and you can't give up, and you have to keep fighting for it.
Dr. Shagog says Lazarex is also working on establishing an online cancer wellness hub, one they hope will help other cancer patients better navigate their options throughout this difficult journey and hopefully help save lives. Reporting in Chicago, I'm Eric Cox for BNC.
Wow, I'm glad they're out there doing the hard work to save those lives out there, because it is shocking when you think about the cancer rate in the African American community. We are leading in most of the cancers that are out there on the charts of having the highest rate of cancer in our communities.
Yeah, and that's where I was going to. There's none of us, no matter what color you are, who doesn't have a story touched by cancer. It's just awful to watch people you love or yourself to go through something like that. But when you add in the other stressors that we know exist in our community that are painful, great stressors, just to see that there's additional measures, additional things you can do to help save lives, it's just so important. It really is. And it makes you say again, when are we going to beat this thing? When? We could do so many things. Shannon, we got billionaires now who are launching their own rockets. When are we going to beat this thing?
I think one of the things that will help is encouraging our family members to eat healthier, to go to the doctor more often, to get these checks more often. Things can be detected earlier now, and if you find out earlier, then you can help try to prevent them and put a stop to them, especially if they're systemic in your family and your genetics. They carry on, so get those checkups, everybody. It's important.
Yeah, don't be afraid. Don't be afraid. Knowing, there's power in knowing. It's not always going to be the worst, like, well, you have no time to let. Knowing means you can mitigate some of this. So yeah, that's a good report by Eric there.